sensitive, and they basically just shred the whole joint again by ripping apart all the type 1 collagen that formed. And then they start rehabbing it from scratch because you just generated a brand new response again. But you've got all that debris, and it's a real mess. It's problematic. The other way you can do it is you start breaking the scar tissue in increments. So like what we do when it's forming is we rehab it gently and slowly. They rehab it more aggressively, and so instead of ripping it all apart at once, they break a piece, break a piece, break a piece, break a piece, and then a little bit of rehab as they go. So, okay. Any questions about the remodel phase so far?
Not so far.
The same rules apply. As the body is replacing the type 3 with type 1, the more you stimulate the joint, the faster and more thoroughly it replaces all the type 3 collagen. If you don't move the joint, if you're not stretching, exercising, and stimulating that joint, the 2 negatives of the remodel phase is, number 1, if there's not enough stimulation, the body leaves the type 3 collagen there to some degree. You can't even get rid of all the type 3 collagen, even in a best case scenario. Right. Do we want to leave any type 3 collagen in the joint?
I think that there is type 3 collagen left in the joint.
There is, but do we want it there?
I could see how it could be a little bit more flexible.
No, that's no, we don't. The answer is no. We don't want any type 3 collagen there because it is weaker. And right. Yes, it can remodel itself a little bit, but it's really just an inferior molecule. We want it all. We don't want anything remembering the joint. We want all the type 1 collagen back, and we want it all straight. And then one of the reasons you can't get 100% is because there's still leftover type 3 collagen in the joint, and we don't want it. So we're trying to get as much of the type 1 as we can. And so the best way to do that would be to adjust the patient daily and do aggressive traction on the joint throughout the entire remodel phase. Because remember, traction is the most stimulatory and adjustments are the deepest. But the goal is we switch them to exercises during the repair phase. We start training them. And then in the remodel phase, they might come in. If they had a good outcome, if they're feeling great, we tell them come in once a month. Because because they can keep doing, now they have to do exercises 2 or 3 times a week is more than adequate to get phenomenal results in the repair phase. So we really switched to kind of that at-home version. Here, just do these exercises. And they really only have to do them for about 3 months into the remodel phase because they're 95% healed.
Right.
Of course, we want them to keep doing it because we want optimal outcome. But and so we might tell patients, now, if you have someone who has arthritis and they have, like I said, a lot of our patients, they're never going to get 80%. We're hoping to take them from 10% to 40% or 50%. I mean, for most of my patients who are really messed up and they're desperate and they've had this problem for 20 years and they've rehabbed it all wrong. And, even with the PRP, even with the cold laser, even with the adjustments, even with the anti-inflammatories, we're going to be lucky to take them from 10% strength to 40% strength. And so for a lot of these patients, even in the remodel phase, they need ongoing care. So we have, probably 20% of my practice is decrepit old patients who I rehabbed to the best of our ability. And then they come in once a month for a tune-up. We stretch out their joints. And I'll explain why that's beneficial. And I'll also talk about the chronic inflammatory syndromes that we deal with. And we're going to talk about arthritis and, what a realistic outcome is. So we do have those patients as well that come in. But anyway, I think you get the idea of the remodel phase. I think you understand the repair phase and the inflammation phase, right?
Yeah.
And I think you understand your role, what your role is going to be. You're going to turn this process back on in ways that we cannot even hope to do.
Right. Yeah. Just by delivering the body's own tools, really.
Oh, exactly. And we've already seen, like, the exciting thing when we started this a year ago is basically you're going to get, we got 50 to 60% of our patients that come in, they're a mess, and we get great results just with doing the rehab we do. You're going to be seeing 50% of our patients where we go, this is a tough case. I can get a 30% better outcome, and that's going to make all the difference to this patient in the long term. We've had almost none of our patients, the really tough cases that we've set to get PRP and stem cells, 90% of them get beautiful results. And these are the patients that we couldn't get great results with. We get mediocre results, and now we get really good results. So it's really fun. It should be really rewarding for you. That's everything I got for you.